Get updates. We're now seeing people not wearing masks anywhere. Others are still choosing to wear masks in certain places. To help us understand the recommendations, make the best decision for our own health, we have Dr. Cynthia Snider from Cone Health here today for To Your Wellbeing. She is their infection prevention medical director. So let's first start off with, what are the new mask recommendations based on?
So the CDC recently gave new guidance to incorporate not only how much COVID is in the community, but also takes into consideration like hospital capacities. And so what's really neat is that the CDC has created a map that you can look up your county to see what category you fit in. And so it's similar to like I would say like a speedy, like a light where it's your traffic light where it's either green, yellow, or red. And luckily, Guilford County just recently is now in that green category, which really means that the rates are low, the hospitals are doing okay. So anybody that needs to come in to be evaluated for anything, please come on in. It also mentions that if you have symptoms, definitely still get tested. If you're not up to date on your vaccine, this is a perfect time. The times where we would want you to wear a mask is for those who are immunocompromised, and it's that the folks who we know that probably don't respond to the vaccine very well should still be wearing a mask in public, especially in indoor areas. Areas where it has not changed, masking is still required in the hospital and it's still required on public transits.
Mm-hmm. All right, so how can people find the transmission rate for their area, no matter where they are?
So the CDC has like a COVID map, but you can also go to conehealth.com/COVID and the link is there.
Okay, and then that way you'll get to see where you are living, whether you're in the red or the other colors, the yellow or the red or green. Yeah, okay. So walk us through the risk levels there and how it applies to those mask wearing with the green, the yellow, and the red levels.
Sure. So the lowest category would be considered the green zone, which we're in. And that's really when the rates are the lowest, when the hospitals are not filled to the max, and the risk of transmission is very low. We know that it is safe in schools. Kids have now, it's optional to wear masks, and also for folks who still feel like they're not quite ready to stop wearing a mask, it is obviously fine to still use it. And the key thing is that it's really based on the transmission rate and the rates in the community. If the rates start getting higher, and we're also seeing more hospitalizations associated with that, you move into the yellow zone. And that's really, again, where we still want people vaccinated, get tested with symptoms if you have symptoms, or also this is also a good time to wear a mask if you have been exposed to somebody, right? There's that period, like right before you start having symptoms, that you can still be shedding infectious virus. And those precautions, I think, are really good to prevent spreading cases around. And then again, if those rates really shoot up again with our next surge, that's when the rating will go back up to the red zone, where everybody should be wearing a mask indoors. And this opportunity now for it kind of does give a breath of fresh air. When the rates are low, I think people are less anxious a bit, but still I think it's really important, especially if you're not vaccinated or under vaccinated, realizing that your risks are greater for contracting COVID, especially when you're in the yellow and red zones.
Okay, so I picked up on one other factor that people should consider when making their mask decision, and that is if you've been exposed to someone that had COVID, you should probably mask up. Is there anything else, any other factors people should consider when making mask decisions?
Yeah, so still the key thing though is that, when somebody is obviously having symptoms, you should obviously wear a mask and get tested. And if people are positive and are in, they're not staying home that whole 10-day period, they should be wearing a mask during that process.
Now, do you need to wear a mask if you've recovered from COVID-19?
As long as you've finished that isolation period of 10 days, then and have improved and no longer having symptoms, then you cannot wear a mask.
Right, and I think we covered where masks are required, so definitely in the hospital. So don't be surprised when you go to the doctor or anything like that you're being asked to wear a mask.
Correct. And including visitors, right? So as you are going to visit some loved ones or friends, you'll still be asked to be wearing a mask the whole time. And then also for public transits, obviously our local buses and trains and flights, you'll still need to be wearing a mask at this time. And then I believe also at skilled nursing facilities, they'll require visitors to wear masks. And then also possibly at like local jails and areas like that.
Okay, now are there any other COVID updates that people need to know?
I think the main thing is that we're heading into a bit of a sweet spot. I would say this reminds me a little bit of part of the summer or come, I think at the end of October, beginning of November, where our rates were low. We're able to do a lot of activities outdoors without masks and also being indoors without masks. But the key thing is making sure that, if anyone's exposed or has symptoms, that's the important part of wearing masks indoors so that you're not exposing others.
Okay. All right. So now you have your chance to ask Dr. Snider your questions. For the rest of the show, she's helping you navigate the pandemic and hopefully towards the endemic, answering your questions directly. And here's how you get your question to her. You text us that question. It's 336-379-5775. We're going to take a quick break and we'll be back.